so thirsty. I mean, I've gone through all of these cups of water and it's only 9 a.m. Could you grab me another glass of water? I've just been really hungry lately. I think if I just eat this little snack before supper, I should be okay until then. Lately, I've just been so tired, I don't want to do anything at all. I don't even like to go up to the bathroom sometimes. Sometimes I just... Oh, hold on. I have to go to the bathroom again. Sorry, I just go to the bathroom all the time lately. Does someone you love or know experience these type of symptoms? If so, they should make an appointment with their primary care provider today.
How you doing today, Hannah?
I've just really been super tired and I've been going to the bathroom like every 15 minutes and I just seem like I can't get enough to eat. I'm always hungry and I just drink tons of water. I'm just thirsty all the time. No matter how much water I drink, I'm just super thirsty all the time. And sometimes my vision gets blurry when I'm driving, so I'm even scared to drive now.
Do you feel fatigued at all?
Oh, very fatigued. I mean, just talking about it just makes me like out of breath right now. I don't know. It's just really hard to get out of bed some days too.
When did these symptoms start?
They were pretty onset, probably about a week ago.
Okay, well, these are very similar to signs of diabetes, so I'm just going to get you tested to see if it is diabetes, and if not, we can rule it out and go from there.
Okay, thank you.
Type 1 diabetes is a chronic autoimmune condition that occurs when the body's own immune system attacks and destroys the insulin-producing beta cells of the pancreas.
This attack leaves the pancreas with little or no ability to produce insulin, a hormone that regulates blood sugar. Sugar stays in the blood and can cause serious damage to organ systems.
People with type 1 diabetes must inject or pump insulin into their bodies every day to carefully regulate blood sugar and stay alive.
This means insulin dependency for life. Diagnosed at any age, threatens devastating complications, demands meticulous planning to avoid life-threatening situations.
Type 1 diabetes is a diagnosis that you cannot outgrow throughout your life. Insulin is required in patients with type 1 diabetes. Patients with type 2 diabetes are not generally prescribed insulin until other measures such as lifestyle changes and oral drug therapy. Insulins come in many forms, such as rapid-acting, short-acting, intermediate-acting, pre-mixed forms, and oral forms. When taking insulin, you can be prescribed 2 or more different forms at the same times. Example, patients taking metformin that are prescribed Levemir are informed to continue on metformin after prescribed on Levemir.
For example, a long-acting insulin is insulin Detmir, also known as Levemir. It's used to control hyperglycemia in patients with type 1 or type 2 diabetes. It's used to lower blood glucose by stimulating glucose uptake in skeletal muscle and fat and inhibiting hepatic glucose production.
The classifications of this drugs are the therapeutics are antidiabetics and hormones. The pharmacologic are the pancreatics. The dose of this drug is subcutaneous 0.1 to 0.2 units per kilogram, once daily in the evening or divided into 2 doses daily, or 10 units once daily in the evening, or can also be divided into 2 equal doses.
Some adverse reactions to monitor for are hypoglycemia, hypokalemia, lipid dystrophy, pruritus, arrhythmia, swelling, and allergic reactions including anaphylaxis.
As a nurse, you should educate your patient on the signs and symptoms of hypo and hyperglycemia. Make sure they monitor their body weight periodically. Monitor serum potassium level in patients at risk for hypokalemia. If your patient is shaky, tachycardic, sweaty, dizzy, anxious, hungry, fatigued, having blurry vision, headache, irritability, make sure you know these signs are considered hypoglycemic signs and that they need to be treated right away. If your patient is in unconscious state, IV glucose, glucagon, or epinephrine should be initiated if patient has had an overdose.
It's important to remember not to share your insulin pen with anyone. This medication controls hyperglycemia but does not cure diabetes. Therapy is long-term. It's important to eat healthy and exercise regularly. Carry a source of sugar with you and an identification card describing your disease. Regular follow-ups are needed, and it's important to know the signs and symptoms of hypoglycemia and when to call the doctor.
The cost of Levemir can be pretty pricey. Right now, without insurance, it can be $177.61 for 10 milliliters per vial. And then the Flex pen, which is a 3 milliliter pen, is $290.07. And you get 5 pens. There is no generic alternative for Levemir. It is covered by most Medicare and insurance plans. One disadvantage to insulin therapy is Medicare Part B does not cover insulin unless use of a pump insulin is medically necessary. Insulin pens, syringes, needles, alcohol swabs, and gauze. There are many advantages to insulin therapy, such as decreased hypoglycemic events, better glycemic control, greater mealtime flexibility, lower postprandial hyperglycemia, and greater convenience for the patient. One big downfall is it is higher cost than human insulin.